Order. Question number 4, Dr. Shane Reti.
Thank you, Mr. Speaker. To the Minister of Health, how will social bonds help deliver better health outcomes?
The Honourable Dr. Jonathan Coleman.
Mr. Speaker, Budget 2015 set aside nearly $29 million for social bond pilots that will see the government paying upon delivery of solutions to tough social challenges. Social bonds will see NGO providers partnering with sources of private capital to deliver on contracted outcomes in health and other social sectors.
True.
Supplementary question, Dr. Shane Reti.
To the Minister, how will the first social bond work?
The Honourable Dr. Jonathan Coleman.
Mr. Speaker, the first social bond will build on a successful pilot where an NGO has placed employment experts into a general medical practice to assist mental health patients into work where appropriate. While the contract details are being finalised, an NGO provider, in partnership with a private source of finance, will agree to deliver an increase in outcomes for this patient group. Payment occurs when results are delivered.
A supplementary question, Derek Ball.
Supplementary to the Minister. Is the use of social bonds not simply the Minister's admission?
Order. Can I just ask the member to start his question again? The first part of the question, the microphone wasn't with the member.
Is the use of social bonds not simply the Minister's admission that the government's form of investment approach and welfare reform has failed outright, and now instead think that profit, not people, is the right motivation to solve our complex social issues?
Mr. Speaker?
The Honourable Dr. Jonathan Coleman.
No, absolutely not, Mr. Speaker. I mean, this is in addition to everything that we've already done. We have tried some very innovative solutions during our time in government to achieve some of those tough, better public service targets, and that's why the lifetime liability for beneficiaries has decreased by $7.5 billion under this government. That's why there's 42,000 fewer kids in New Zealand living in beneficiary homes than 3 years ago, and we will continue to focus on what works.
Supplementary question, the Honourable Annette.
In light of his answer to Dr. Shane Reti, is he aware that an employment officer was placed within a PHO when we were in government, but his government cancelled such a project?
The Honourable Dr. Jonathan Coleman.
No, but what I am aware of is that when that person was Minister, she was not successful in getting mental health people.
Order. The Minister resumes. He's answered the question, the very first part of his answer. Question number 5,